Has someone you love started showing small changes that raise concerns? It's easy to dismiss subtle shifts in behavior or health as just the natural course of aging. But in reality, the body often gives quiet clues long before it reaches the final stage of life. These signs can be easy to overlook, especially because they appear gradually. Only later, when we look back, do we realize they were there all along. By then, it's often too late to make the most of those precious final moments. In this video, we'll explore 5 key signs that may appear a year before an elderly person passes away. These changes might seem insignificant at first, but understanding them can help you prepare emotionally and practically for what's ahead. Recognizing these early on means you can give better care, create meaningful memories, and ensure your loved one's final months are filled with comfort and dignity. Stay with us, because these 5 signs could make a significant difference in how you approach the later stages of life. Let's dive into these signs and see what they mean. Number 1. Unexplained weight loss. One of the earliest indicators that someone may be nearing the end of life is unintentional weight loss. It often begins as a slight change. Your loved one might mention needing to tighten their belt, or you might notice their clothes fitting looser than before. The appetite starts to dwindle, and food doesn't seem as appealing anymore. This might seem like just an aging issue, but the reality is that losing weight without effort can be a red flag. It could indicate that the body is struggling to absorb nutrients, or that vital systems, like the digestive and muscular systems, are starting to decline. The body may no longer process food the way it used to, and this can lead to muscle loss, leaving the person frailer and weaker. Some may even feel a lack of hunger. As the body winds down, the brain doesn't signal the desire for food as often, resulting in smaller meals or skipped ones entirely. In many cases, weight loss can also signal underlying health problems, such as heart disease, cancer, or even depression, all of which may worsen in the background without obvious symptoms at first. It's natural to want to encourage your loved one to eat more or indulge in their favorite foods. But if the weight continues to drop despite these efforts, the focus should shift. Forcing large meals won't help. Instead, focus on offering easy-to-eat foods, hydration, and comfort, which can make a real difference in their quality of life. If you see significant weight loss, along with signs of weakness or loss of energy, it's time to pay attention. These changes aren't just cosmetic. They signal that the body is preparing for something deeper. Recognizing this early can help you be more prepared for what's to come. Number 2. Persistent fatigue and weakness. As a person's health begins to decline, extreme fatigue becomes one of the most noticeable changes. This isn't the normal tiredness that comes from a busy day. This is a deeper exhaustion that doesn't go away, even after rest. Simple tasks like getting out of bed or walking to the kitchen can become incredibly draining. A once active person may find themselves retreating into a more sedentary lifestyle simply because they lack the energy to do anything else. This fatigue happens because the body is slowing down. As circulation and organ function decrease, the body becomes less efficient at producing energy. The muscles, which need oxygen to function, become weaker, and even routine activities become difficult. Sometimes your loved one might sleep for extended hours or require several naps throughout the day. The emotional impact of this fatigue can also be profound. Seniors who once felt proud of their independence might feel frustrated or even embarrassed by their inability to do things they used to do. This can lead to isolation, as they withdraw from social activities or avoid engaging with family and friends. For families, seeing a loved one go from active to lethargic can be hard to accept. But it's essential to understand that pushing them to keep going won't help. What they need most is understanding and support, allowing them the time to rest and recover without the pressure to do more than they can handle. If you notice that your loved one's fatigue is more persistent and cannot be relieved with sleep, it's a sign that the body is winding down. Now is the time to offer your presence, create moments of peace, and support them in whatever ways you can. Number 3. Cognitive decline and emotional withdrawal. One of the more challenging changes to witness in a loved one is a decline in cognitive function. It might start with moments of confusion, like forgetting names, losing track of conversations, or misplacing objects in familiar places. Over time, these lapses can become more pronounced, as memory and comprehension begin to fade. The person may have difficulty following a conversation or may seem disoriented, even in their own home. This cognitive decline happens as the brain's supply of oxygen and nutrients decreases, making it harder to process information and remember things. In some cases, this leads to a lack of interest in socializing. What once brought them joy, like spending time with family or engaging in hobbies, may now seem like too much effort. They may prefer solitude or withdraw emotionally, even if they don't want to. Sometimes, this emotional withdrawal can look like a complete detachment, where the person no longer reacts to things they once cared about. They might be more irritable, anxious, or just seem disconnected from the world around them. This isn't their choice, it's the brain's way of adjusting to the body's decline. For caregivers, these changes can be especially painful to witness. But rather than trying to pull them back into conversations or interactions, it's important to meet them where they are. Speak kindly, offer reassurance, and let them know that you are there for them, even if they aren't able to engage in the same way. If you notice increasing forgetfulness, confusion, or emotional withdrawal, it's essential to understand that this is part of the natural process. Be patient, create a calm environment, and continue to offer love, even when words or interactions become more limited. Number 4. Recurring infections and slow recovery. As the body nears the end of its life, the immune system weakens. Minor infections that once would have cleared up quickly may now linger, or even worsen. A cold or a simple scratch can become more serious, as the body's ability to fight off infections diminishes. Repeated infections, especially ones that don't seem to heal properly, are often signs that the body's natural defenses are failing. You may notice that your loved one's infections seem to come and go more frequently. Pneumonia, urinary tract infections, and skin infections might occur with more regularity, and recovery can take much longer than it did in the past. Even something as small as a bruise might not heal the way it used to, and wounds can become infected more easily. This slow healing process happens because circulation slows down, making it harder for the body to bring oxygen and nutrients to the injured areas. This can lead to chronic wounds that require more attention and care, such as pressure sores, which can be difficult to manage without proper medical supervision. For families, it can be tempting to seek aggressive treatments, hoping for a quick fix, but sometimes the focus shifts from curing to providing comfort. It's important to ensure that your loved one stays hydrated, rests, and receives the necessary care to manage infections without overburdening their body. If you notice repeated infections or a slower recovery rate, it's time to shift your approach from treating to comforting. Recognizing this sign early can help make the final stages more manageable and less distressing. Number 5. Changes in breathing patterns and circulation. The final sign that the body is preparing for its final transition often comes in the form of breathing and circulation changes. You may notice that your loved one's breathing becomes more shallow, irregular, or labored. Sometimes they may pause between breaths, or their breathing may speed up and slow down unpredictably. In many cases, people near the end of life experience something called Cheney-Stokes respiration, a pattern of alternating deep breaths followed by periods of no breathing at all. This is a normal part of the process, but it can be unsettling to witness. You may also notice a decrease in circulation. Hands and feet may feel cold to the touch, and the skin may take on a pale or bluish tint. This happens as the body directs blood flow to vital organs, reducing circulation to the extremities. This can also lead to shortness of breath with minimal movement, as the lungs begin to struggle to maintain normal function. For caregivers, seeing these changes can be both distressing and frustrating. It's important to remember that these shifts are part of the body's natural decline. The focus should be on making your loved one as comfortable as possible, keeping their room cool, offering small sips of water, and using pillows to support their breathing. Final thoughts. As we wrap up this video, let's reflect on the 5 signs we've covered: weight loss, fatigue, cognitive changes, infections, and breathing issues. While these can be hard to witness, recognizing them early can help you prepare both emotionally and practically. This awareness can lead to more meaningful conversations, better care, and, ultimately, a more peaceful final chapter. If you're noticing any of these signs in a loved one, know that you're not alone. Many families have walked this path before you. It's a challenging journey, but understanding these signs can help bring peace and clarity during a difficult time. Thank you for joining us. If you found this video helpful, please like, comment, and subscribe. Your support helps us continue to create valuable content. We look forward to sharing more insights with you in the next video.